We often think about doctors needing to know all the science, right? But what about the human side of things? How did they actually practice for their most stressful, most emotionally draining conversations? Well, today, we're diving into a really fascinating study that uses AI to create virtual patients. And these aren't just any patients. They are designed from the ground up to be difficult, to help train doctors for the absolute toughest talks of their careers.
So, here's how we're going to break it all down. First, we'll look at why the old way of training has its limits. Then, we'll get into the actual psychological model they use to build these AI personalities. After that, you'll get to meet the virtual patients themselves, we'll see how they held up under testing, and finally, we'll talk about what this could mean for the future of medicine.
All right, let's set the scene. Being a good doctor is so much more than just diagnosis and treatment. It's about communication. But practicing for those really high-stakes, emotional conversations, well, that's incredibly difficult. And this is where the whole study really begins, by looking at the problems with how we've been doing it up until now.
Which brings us to this big question. I mean, if you're a med student, how do you get practice dealing with a patient who's angry, or maybe skeptical, or just completely overwhelmed with emotion? You can't just practice on real patients, right? For years, the answer has been to use something called standardized patients.
So standardized patients are basically trained actors who simulate illnesses. And look, it's a decent system, but it's got some major hurdles. It costs a lot of money to hire and train these actors, which makes it really hard to scale up for thousands of students. Plus, you can't be sure every student is getting the same experience, and it's tough to create a bunch of different, repeatable scenarios. And that's exactly the gap that this new AI technology is trying to fill.
Now, to create a virtual patient that feels real, you can't just tell the AI to act angry. That's not how people work. You need a real psychological blueprint. And this is where the researchers did something brilliant. They turned to the work of a family therapist named Virginia Satir, which gave them the perfect foundation for building a believable AI.
The Satir model is such a great tool for this because it's not just about general personality types. It's specifically about how people communicate when they're under stress, like when they're facing a serious illness. It basically gives us a map for how humans behave in these really tough situations. And those behaviors are predictable, but still very nuanced.
Satir breaks these stress responses down into 5 styles. You've got the appeaser, who avoids conflict no matter what. Then there's the accuser, who's always blaming someone else. The rationalizer hides behind cold, hard logic. The distractor tries to change the subject. And finally, you have the ideal, which is congruent, where someone is open and honest. For this study, the researchers decided to focus on 2 of the most challenging types to deal with, the accuser and the rationalizer.
And this is where things get really, really cool. How do you take these complex psychological profiles and actually turn them into a conversational AI that a student can talk to? Well, the answer, as you can probably guess, lies in today's most powerful language models.
The researchers went with GPT-4 to bring their virtual patients to life. But they didn't just give it a simple command. No way. They built these incredibly detailed prompts, feeding the AI everything from the patient's medical history to their personal life, and then they layered that specific Satir communication style right on top.
But here's the secret sauce, what really made this work. They developed something called the stubbornness mechanism. See, the problem is that language models are designed to be helpful. A frustrated, difficult patient is not helpful. So to make the AI believably uncooperative, they gave it specific rules. For instance, the AI was programmed to absolutely refuse to discuss therapy until the doctor first validated its feelings. It's this little detail that makes the whole thing feel so genuinely difficult. So, after all that brilliant work, who did they actually create? It's time to meet the 2 virtual patients at the center of this study, Gerhard the accuser and Andreas the rationalizer. So on one hand, you have Gerhard. He's a bus driver with chronic pain from an old accident. He's frustrated, feels like nobody's listening to him, and his style is to blame everyone else. He just wants the pain gone, period. Then you have Andreas. He's a manager, and he's all business. He presents his symptoms like a technical report, and he completely dismisses any suggestion that stress could be a factor. He's convinced he just needs a B12 shot, not a chat about his feelings. 2 very different and very realistic challenges.
So creating these AI personas is one thing, but are they actually believable? To figure that out, the researchers put them to the ultimate test. They took their virtual patients to a major conference and had real medical professionals interact with them. Let's see how they did.
So, the first big question was, did they feel real? Well, on a 5-point scale, both the accuser and the rationalizer scored really well on authenticity, a 3.8 and a 3.7. That's a huge deal. It means that the pros, the people who deal with patients like this every day, found the AI simulations to be very convincing.
Next, they looked at the tone of the conversations, and this just perfectly shows the difference between the two AIs. Gerhard, the accuser, came across as clearly negative, which totally fits his frustrated personality. But Andreas, the rationalizer, was much more neutral, more detached. The AI wasn't just being difficult in one way, it successfully created two distinct emotional tones.
And here's the real clincher. Could these professionals figure out which communication style they were dealing with? The results are pretty amazing. For Andreas the rationalizer, 60% of the participants correctly identified his style. And for Gerhard the accuser, a full 50% pegged him correctly. This proves the AI wasn't just creating a generic, angry guy. It was successfully embodying the specific psychological traits it was programmed with.
Okay, so we've established the AI works. It's convincing, and it can mimic these complex human behaviors. So what? What does this all mean for the future? Well, this is where a cool experiment starts to look like a real revolution.
This kind of technology could solve almost all the big problems with traditional training. It's accessible 24/7, from anywhere. It's infinitely scalable. You can train thousands, even millions of students at once. It guarantees that every single student gets the exact same high-quality, challenging practice. And maybe, most importantly, it gives trainees a safe space, a place to make mistakes, to say the wrong thing, and to learn without any risk to a real patient.
And that all leads to this one final, really big thought. This study shows that AI can do way more than just spit out facts. It can simulate the very nuanced, very tricky parts of human communication. So if we can use it to teach doctors empathy, what other deeply human skills are next? Could it teach negotiation, leadership, conflict resolution? The potential here is just absolutely massive, and we are only just beginning to see what's possible.